Welcome to Expert Living, your trusted source for expert insights into health, wellness, and well-being. Today, we're covering a topic of immense importance: heart disease in women, and how it differs from heart disease in men. Heart disease remains the leading cause of death among women, yet so much about its signs, symptoms, and progression is misunderstood or overlooked. Women's experiences with heart disease can differ significantly from men's in both subtle and substantial ways, often making diagnosis and treatment challenging. Today's video will walk you through these differences, helping you understand the critical signs to watch for, risk factors unique to women, and ways women can actively work to prevent heart disease. Heart health isn't just a topic for awareness, it's one of life and longevity. So, if you're ready to take charge of your health, let's dive right in and uncover everything women need to know about heart disease. Understanding heart disease in women and men. When people think about heart disease, they often picture an image dominated by one primary symptom: sudden, severe chest pain. While this is indeed one form of heart disease presentation, it's far from a universal experience, especially for women. The symptoms of heart disease in men and women can appear drastically different, and understanding these differences is essential for awareness, early detection, and effective treatment. Heart disease is not a one-size-fits-all condition, and each gender's experiences, risk factors, and biological predispositions contribute to the way it manifests. In men, heart disease is typically associated with plaque buildup in the major coronary arteries. This condition is known as coronary artery disease, CAD. CAD often leads to more overt symptoms, such as chest pain or angina, shortness of breath, or even heart attack. In women, however, the development of heart disease can differ on multiple levels. Women are more likely to experience coronary microvascular disease, CMD, a condition that affects the small arteries of the heart. Unlike the large blockages seen in major arteries with CAD, CMD often involves damage to the heart's smallest blood vessels, which can lead to restricted blood flow and oxygen supply. This difference may seem minor, but it results in much subtler, less predictable symptoms that are often mistaken for other ailments. This is part of what makes heart disease such a silent killer in women. The subtlety of symptoms can make it harder to recognize, understand, and treat in time. Additionally, women's experience with heart disease is influenced by physiological differences. For instance, women's hearts and blood vessels are generally smaller and more delicate, meaning that even a smaller amount of plaque buildup can cause significant problems. The smaller vessels can also make it more difficult for doctors to detect blockages, often resulting in a delayed diagnosis and treatment. This structural difference, combined with hormonal changes, lifestyle factors, and specific risks associated with life stages such as pregnancy and menopause, makes women's experience of heart disease unique. How heart disease develops differently in women. The development of heart disease in women is influenced by a complex mix of biological, physiological, and lifestyle factors that differ from those typically seen in men. One of the most significant factors impacting heart health in women is the hormonal influence, especially the role of estrogen. Estrogen has a protective effect on the cardiovascular system, helping keep blood vessels flexible and promoting healthy blood flow. For many women, this protective effect lowers the risk of heart disease during their reproductive years, but as estrogen levels decline with age, particularly after menopause, this natural protection fades. This sudden shift leaves postmenopausal women more vulnerable to cardiovascular issues than they were earlier in life, contributing to an overall increase in heart disease risk. Additionally, during menopause, many women experience changes in their lipid profiles, including higher levels of LDL, bad cholesterol, and lower levels of HDL, good cholesterol, which can contribute to plaque buildup in the arteries. Inflammation also plays a unique role in women's cardiovascular health. In women, heart disease is often accompanied by or preceded by inflammation, a factor that's impacted by lifestyle, autoimmune conditions, and chronic stress. While inflammation is part of the body's natural response to injury or infection, chronic, unchecked inflammation can contribute to a higher risk of developing heart disease. Women, who are more likely than men to experience autoimmune conditions, are particularly susceptible to this inflammation-related pathway to heart disease. Key symptoms of heart disease in women. Heart disease symptoms in women are often subtle and can be easily mistaken for less serious conditions, leading many to ignore or downplay them. Unlike the classic chest pain or pressure often seen in men, women's symptoms are more likely to manifest in the form of fatigue, shortness of breath, or pain in areas not traditionally associated with heart trouble. Women should be aware of the following symptoms, as they may indicate heart disease: unusual or excessive fatigue. This isn't simply feeling tired after a long day. Instead, it's a profound, sometimes overwhelming fatigue that can last for days. This fatigue might occur without any obvious reason, and women may feel exhausted even after getting adequate rest. Fatigue in this context isn't just a side effect of daily life, it can be an early sign of heart disease. Shortness of breath. Many women report shortness of breath as a primary symptom of heart disease, often feeling winded after activities that previously didn't present a challenge. Shortness of breath may occur suddenly or become more pronounced over time, and it can be mistaken for signs of aging, lack of fitness, or anxiety. However, shortness of breath can signify an underlying issue with the heart's ability to pump blood effectively. Pain in non-chest areas. While men often experience chest pain as a primary heart attack symptom, women may experience pain in areas such as the back, neck, jaw, or stomach. This pain might be sharp, dull, or intermittent, making it easy to dismiss as muscular pain or indigestion. Some women describe jaw pain that radiates or an ache between the shoulder blades that appears out of nowhere. Nausea, dizziness, or lightheadedness. These symptoms can occur suddenly and may be mistaken for issues related to the stomach, flu, or even anxiety. Nausea or dizziness without any apparent cause should be taken seriously, as they may indicate a restriction in blood flow to the heart or brain. Heart palpitations or a racing heart. A sudden awareness of one's heartbeat or the feeling of a racing heart can be a warning sign. While occasional palpitations may be harmless, a regular occurrence without an apparent cause could point to cardiovascular issues. Each of these symptoms alone may not raise immediate alarm bells, but collectively, they can signal an underlying cardiovascular problem. For many women, symptoms come and go, vary in intensity, or simply feel off. These symptoms are easy to downplay or dismiss, especially when everyday life demands attention. However, it's essential to recognize these signals and to seek medical guidance when experiencing any combination of these symptoms. Risk factors unique to women. Women's heart disease risk factors are multifaceted, and many are unique to women's life experiences and physiology. Pregnancy, menopause, and other hormonal changes all play critical roles in shaping heart health, making it important to understand these specific risks. Pregnancy complications like preeclampsia, gestational diabetes, and high blood pressure can have long-term effects on heart health, even after delivery. Women who experience these conditions are more likely to develop heart disease later in life, as these complications can cause lasting changes in blood vessels, metabolism, and inflammation. Autoimmune diseases, which are more common in women than men, also contribute significantly to heart disease risk. Conditions like lupus, rheumatoid arthritis, and other inflammatory disorders can increase cardiovascular inflammation, leading to an elevated risk of artery damage, blood clots, and other issues that affect the heart's health. Women with autoimmune conditions often need to take extra precautions and work closely with healthcare providers to manage their overall risk. Emotional and mental health factors also play a vital role in women's cardiovascular health. Studies show that women are more likely than men to experience chronic stress, anxiety, and depression. These conditions impact heart health through a range of mechanisms, including increased blood pressure, higher levels of inflammation, and lifestyle behaviors that may contribute to heart disease risk, such as poor diet, lack of exercise, or smoking. Chronic stress, in particular, has been linked to heightened inflammation, one of the key contributors to heart disease. Importance of early detection and regular checkups. Early detection through regular checkups and screenings is one of the best ways to catch heart disease before it becomes severe. For women, comprehensive health screenings are essential, as traditional assessments may not be sufficient to detect issues in the smaller arteries or assess other unique risks. Regular screenings should include measurements of blood pressure, cholesterol levels, and glucose levels. For women who exhibit symptoms that might indicate CMD or other forms of heart disease, advanced testing, such as imaging or stress tests, can help provide deeper insights into their cardiovascular health. For women, advocating for comprehensive health care is a crucial part of maintaining heart health. This means working with healthcare providers to go beyond the standard tests and ensuring that any unusual symptoms are thoroughly investigated. Women should feel empowered to speak openly about their symptoms and ask for specific screenings if they suspect an issue with their cardiovascular health. Preventive steps women can take for heart health. Women can take proactive steps to prevent heart disease by adopting a lifestyle that supports cardiovascular health. This includes maintaining a diet rich in fruits, vegetables, whole grains, and lean proteins. Avoiding processed foods, limiting trans fats, and reducing salt and sugar intake are all critical to a heart-healthy diet. Regular physical activity, such as brisk walking, cycling, or strength training, is also essential for heart health. Aim for at least 150 minutes of moderate aerobic exercise each week. Maintaining a healthy weight, managing stress, and avoiding smoking are other important steps women can take to reduce their heart disease risk. Reducing alcohol intake and prioritizing quality sleep are also vital. For women with pre-existing conditions or a family history of heart disease, it's essential to have regular checkups and follow any prescribed treatments, medications, or lifestyle modifications recommended by healthcare providers. Conclusion: taking control of your heart health is a journey of education, awareness, and proactive care. By understanding the unique ways heart disease presents in women and recognizing the risk factors and symptoms, you're already one step closer to safeguarding your health. Remember, heart disease is preventable in many cases, and with the right lifestyle choices, regular screenings, and awareness, women can empower themselves to live long, healthy lives. At Expert Living, we're here to support you on your journey to optimal health. Thank you for watching, and stay tuned for more expert insights to help you live your best life.